curiosity is the gasoline in our tank. These are questions that we want to be curious about, and not questions we have to answer just within the narrow framework of the model. One very key element in TIST, you've probably heard me say it 100 times, is the problem of the prefrontal cortex being inhibited by trauma responses. So the client is going to be triggered. The prefrontal cortex is going to shut down. The parts are then going to have a field day because any restraint on them comes from the prefrontal cortex. And if that's shut down, there's sort of no boundaries for the parts. In the beginning stages of therapy, it's helpful to use as much psychoeducation as the client can tolerate. And I'm going to underline as the client can tolerate 10 times, because if the client can't tolerate psychoeducation, then we don't do it. But what I found is that most clients, not all, but most clients really find the model interesting, and we have lots of rich discussions about what they notice in themselves, right? Do they have a submit part? And they might even, most of the clients to whom I teach the model always say yes if I say, do any of these parts seem familiar to you? They almost always can answer the question, which parts cause you the most difficulty? And I think maybe some of that is because the psychoeducation is relational. So I don't just say, okay, this is session 1, time for the psychoeducation, or this is session 3, time for the psychoeducation. I wait until the client has a complaint or a need or a distress in the moment. And the psychoeducation is offered as an empathic supportive response. It definitely can't be dry and academic. So we have to be entertaining, which I have to find fun. But probably not everybody does. TIST is also predicated on the assumption that mindful witnessing is crucial and is therapeutic. And that's very, very important, because mindful noticing stimulates the prefrontal cortex. By its very nature, mindful witnessing involves curiosity, right? We notice with interest. And so the bridge between what I think of as the psychoeducation and the processing is mindfulness. Because we introduce the model, but the next step is not talking about the parts. The next step is helping the client learn to notice the parts. And that is very, very, very different. Also, distinguishing their noticing from the parts, really more primitive feelings and impulses, takes practice. But if clients don't get that, it really makes it much harder to get where we want to help them go. And mindfulness also provides a bridge. It's, often it's hard as the therapist to switch gears from, the first session, listening, building a relationship, maybe the second session, listening and building a relationship. The client is in crisis, so somehow psychoeducation feels off. And at some point, when we do say, would I have this theory that might interest you? It's mindfulness that's going to help me bridge the theory with the client's personal experience. And because mindful noticing is present moment noticing, it changes the conversation, because we're not talking about what the parts did yesterday. I mean, we might if there has been a crisis, but in general, in TIST, we're asking the client to notice in the moment. Notice that part that's telling you it's all your fault. Wow, notice the ashamed part just came up. Right now, so maybe the client's was talking about, I've been hopeless all week. I just feel like there's no point. And I say, right now, is the hopeless part here with us? How is the hopeless part doing? And remember that the brain scan research on meditation tells us that mindful focusing stimulates activity in the medial prefrontal cortex and decreases activity in the amygdala. That means when you're helping the client notice, you're making a therapeutic intervention. You could call it affect. I'm doing affect regulation work with my client. Sounds very fancy, much fancier than I'm helping my client to notice. And engagement of the medial prefrontal cortex is an essential ingredient in TIST. So the mindful provides a bridge from the theory to a present moment experiencing. But then we want to take it a little further to think about what kind of experience do we want to help the client have? And I call this how to become a parts whisperer. Because I think it's such an essential part of the work. So we have a change in paradigm, right? That our map requires us to see and hear individual clients as systems of parts rather than just as individuals. Clients are used to assuming that they are whole and integrated, and we're used to that too. And clients also, unlike us, are constantly trying to ignore or change the input that they're getting from the parts, not knowing that they're parts. But distressing feelings tend to be ignored or suppressed. The problem is that ignoring or trying to suppress the input of the parts leads to a breakdown in trust with the parts. The client, often in those early stages, the client doesn't want to provide trust for the parts, isn't interested in the relationship. But we know that trust is built on relationship. We know that it's important that the client slowly become to trust us a little more. But I equally believe the parts have to trust the client. Because why? Why should they stop cutting? Why should they stop starving themselves? Why should they stop going to bed and pulling up the covers? When the client is not someone they can trust to take care of them. So we have to help the client hear the voices of the parts, teach the client to communicate to the parts that they're being heard, because without that, there is no trust. The map often helps us to stabilize clients, or make sense of very, very confusing clinical presentations. But the system, and that's all good for stabilization. Right? The prefrontal cortex becomes more active and reliable. The clients learn to notice the parts that are destabilizing them. But if the client can't change their felt relationship to the part, the whole system can't change. It's really like everything is interconnected. Without the parts trusting the client, and without the client's ability to at least be curious and interested in the parts, nothing changes.